Today we're going to be talking about dark armpits. So let's talk about it, what the causes are and how to treat it. So dark armpits are actually more common, if you notice, in women. Now, one of the things, the most common causes of darkening of armpits over time is that women wax or shave their armpits and then they put deodorant on right away. This can be a sign of what's called post-inflammatory hyperpigmentation. It's technically fragrance-induced hyperpigmentation that falls under the category of post-inflammatory hyperpigmentation. So what happens is when you shave or you wax, you're causing tiny little microcontusions in the skin. They're little tiny little openings or cracks in the skin. Then what women do is they will put deodorant on there. Now, if the deodorant has synthetic fragrance, and then there's also salts in the deodorant. So the combination of those two, along with sweat and oil, can actually cause the fragrance-induced hyperpigmentation. So what I did when I actually had a storefront is I actually would have my clients a couple days before they came in for an underarm wax, I would have them stop waxing and or shaving. And then they would come in and I would ask them to just use cornstarch baby powder, no fragrance, a couple days before to sweat out all of the salts in the deodorant. And then a couple days afterwards, they would not use, I would ask them to not use the deodorant. I would actually have, there was a product that I just loved and they don't sell it anymore. It was a type of barrier cream that actually turned into this powder. And so they don't have it. I'm going to put a link below on some substitutions that you can use that are unscented that you can actually use for deodorant and perspiring. Now, if you're someone who perspires a lot, or you have a condition called hyperhidrosis, then you can use this cream on there and then put cornstarch unfragranced baby powder on there for a couple of days, not use your deodorant. And then I highly recommend that if you are using a heavily fragranced deodorant or antiperspirant, that you switch to a more natural one. And I'll put some links below again on some of the suggestions that I recommend for that. Now, if you don't do that and you do have darkening of your underarms, you may have an underlying condition. Now, here are some of the underlying conditions that you may, not that you do, but that you may have. So first, let's talk about when you have a lot of these darkening areas. This can be a sign that you're actually low in vitamin D. You have too much estrogen or progesterone. This hyperpigmentation condition is typically really stubborn once it gets out of hand. And this is in areas where you'll find around the neck area, forehead, groin area, under your arms, anywhere on your body. And this is called acanthosis nigricans. So this can be a sign that you're low in the vitamin D deficiency, you have too much estrogen, progesterone, insulin resistance, diabetes, or a adrenal issue. It is an endocrine disorder called Addison's disease, where you're not producing enough cortisol or aldosterone. So these are all underlying conditions. Now, for those of you who are new to my channel, my name is Christy, and I have been professionally treating clients for over 18 years, especially in the areas of treatment-resistant hyperpigmentation, acne, and anti-aging. And I'm going to tell you that with all the clients that I have seen, if that was me, that I had these darkening, because they would come in to get treated with that, I would actually go in to see a doctor and get tested to see if I have any of these hormone-related underlying conditions. Now, as far as treating them, usually you'll see a little bit of the hyperpigmentation, and then it gets darker and worse over time if not treated. Now, if it is specifically in the underarm area, related area, I would have them do just the treatment that I had mentioned before, but also I would have them use to get rid of what's already been pigmented, a lightening solution that is more sensitive to those areas. So those areas are not, it is not recommended to use hydroquinone in the areas where it's the underarm or the groin area, the more sensitive areas. You want to use more gentle products, and I will put a description in the link below if you're interested in that. Now, if you have the darkening of the underarms and you also have quite a few skin tags that are developing around your neck, as well as maybe some joint pain, fatigue, a hyperpigmentation on other areas of the body, as well as gut issues, this may be several symptoms that could be Addison's disease. So you may want to check that out. I had a client that had some of these conditions, and I had her get tested. First, I had her get tested for her digestive issues. So after that, I had her go and get tested for Addison's disease. So you may want to look into that, because remember, if you found this helpful, please give this a thumbs up. And remember, makeup is an art, skincare is a science. And remember, again, the descriptions are the links are in the descriptions below. We'll see you in the next video.